So first of all, I want to argue that worldviews profoundly and unavoidably influence clinical decision making. So what's a worldview? Well, very simply, it's a set of foundational beliefs that sort of shapes the way that you look at the world. Postmodernists like to refer to worldviews as meta-narratives. I'm sure you've heard of that term. It's the big story that we tell ourselves about who we are, where we came from, why we're here, where we're going. Sort of the big story that we tell ourselves about what the world is about and what it's like. James Sire, who wrote a wonderful book on worldviews called The Universe Next Door, defines a worldview as a commitment or a fundamental orientation of the heart that can be expressed as a story or in a set of presuppositions about the basic construction of reality and that provides the foundation in which we live and move and have our being. Tim Keller gives something more of a theological definition of worldview. He says that every human personality, community, thought form, and culture will be based on some ultimate concern or some ultimate allegiance, either to God or to some God substitute. So the point is that when we're trying to understand the way that people see the world, we need to understand that everyone carries around this kind of baggage that shapes how they hear things, how they think about things, what they think matters and what doesn't, and so on. We all have a worldview, and that worldview is primarily composed of some ultimate allegiance, either to God or to some God substitute, as we'll explain more. So, is there any evidence that these kinds of worldviews, basic foundational beliefs, influence the way that we practice medicine? Well, I think it's pretty obviously true when you begin to think about the kinds of belief systems that shape moral conflict in contemporary medicine. We're all familiar with some of the issues around conscientious objection and the challenge of practicing medicine as a Christian or as an Orthodox Jew or as a Muslim in the contemporary, because of some of the expectations that are placed upon physicians. And you probably have heard about the court case where the Christian Medical and Dental Society, among others, sued the college because they felt it was an inappropriate and unfair imposition on conscience rights to be forced to refer for euthanasia, among other practices. And the interesting thing is that these kind of conflicts are always demarcated along religious lines. You won't find too many seculars, although there may be some, who feel strongly and passionately about refusing to make a referral. Whereas you'll find many Christians and many Orthodox Jews who feel very strongly about these things. And so this kind of gives us a hint that there are kind of deep underlying differences in the way that we see the world that drive this moral conflict in medicine. And there's empirical data on this, that the way that you see the world foundationally influences, for example, your end-of-life practices. So in this empirical survey published in the Journal of Medical Ethics, they found that non-religious physicians in the United Kingdom were more likely to support legalization for euthanasia, more likely to have administered terminal sedation, more likely to have partly intended to cause death when providing palliative medicine, and more likely have discussed deliberately causing death with their patients. And these differences were profound, statistically significant and clinically significant, big differences in patterns of care between physicians who were religious and those who were not. So again, we see worldview seeming to make a difference in how we approach certain aspects of medicine. This paper, which some of you might remember discussing at the last presentation on the issue of worldview in medicine back in the spring, this paper introduced an interesting argument where these authors, really highly recognized academic physicians in the United Kingdom, argued that when you're writing about abortion or euthanasia or other morally controversial issues in medical ethics, that if you're a religious person, you ought to disclose that as part of your paper, because they're arguing that this functions as a kind of conflict of interest. It biases your view of the issue, and so if people want to understand where you really come from, then you need to be upfront about your worldview. So again, this is tacit recognition, although somewhat one-sided tacit recognition, that foundational beliefs play a profound role in shaping your approach to the practice of medicine.